Rib pain, also known as rib cage pain, can be caused by a variety of physical problems, diseases, or disorders, ranging from a simple pulled muscle to a serious rib fracture. Pain may be sharp, or it may come on slowly as a dull ache that hurts below the chest or above the navel on either side. It may be caused by an obvious injury, like a physical collision during sports-related activity or an auto accident. But it can also be mysterious and seem to appear without explanation. According to medical professionals at the Mayo Clinic, you should report any instance of unexplainable rib cage pain to your doctor immediately, especially if you have a very tender spot in your rib cage area that occurs after trauma. It's also a good idea to talk to your doctor right away in the following circumstances. Pain makes normal breathing uncomfortable or difficult. You have severe pain when breathing in deeply. You experience pain moving your body into a specific position. If your rib cage pain is accompanied by these other symptoms, call 911. You could be having a heart attack. There's pressure and pain in the upper chest area near your heart. You feel weak, lightheaded, or faint. You also have pain or discomfort in the jaw, neck, or back. One or both arms hurt, and there's pain in the shoulder area. You have difficulty breathing or feel extremely out of breath without doing any exercise to cause it. Pain in the rib cage area can also be a symptom of underlying medical conditions like psoriatic arthritis, osteoporosis, or costochondritis. Costochondritis is an inflammation of the cartilage that connects the ribs to the breastbone. Pain caused by costochondritis can be especially worrisome because it feels similar to pain caused by a heart attack or some other heart-related condition.